व्यूअर्स, आई एम नम्रता फ्रॉम कंसल्ट एंड केयर। जैसे कि आप लोगों को पता होगा, लीवर हमारी बॉडी का एक बहुत ही इंपॉर्टेंट ऑर्गन है। बट आजकल लोगों में लीवर से रिलेटेड बहुत सारी बीमारियां हो रही हैं, जैसे कि फैटी लीवर, लीवर सिस्ट, ऐसी अन्य बहुत प्रकार की बीमारियां। इन सब बीमारियों से बचने के लिए सबसे ज़्यादा इम्पॉर्टेंट है कि हमें लीवर के बारे में सारी चीज़ें पता हो। मतलब हम अपने लीवर को कैसे बचा के रख सकते हैं, कैसे उसको सुरक्षित रखना चाहिए, क्या खाना चाहिए, कैसी लाइफ स्टाइल होनी चाहिए। आज इन सब बातों के बारे में बताने के लिए हमारे साथ होंगे एक बहुत ही सीनियर डॉक्टर, डॉक्टर सौमेन रॉय फ्रॉम भुवनेश्वर, उड़ीसा। टुडे वी आर वेरी ऑनर्ड टू हैव डॉक्टर सौमेन रॉय फ्रॉम भुवनेश्वर, उड़ीसा। वेलकम सर।
Good morning, good afternoon, everybody.
Sir, would you like to introduce yourself first for our viewers
Yeah.
better understanding?
Okay, I'm Dr. Soumen Roy. I'm a consultant gastrosurgeon and liver transplant surgeon in Apollo Bhubaneswar, Odisha. Basically, my specialty is dealing with all GI cancers and liver transplants, both laparoscopically and robotic. My emphasis is on awareness about the people regarding the liver and pancreatic disease, which are very less people know about it, and it is very common nowadays. That's why it is a very common thing to aware the people regarding the liver disease.
Okay. Thank you, sir. Sir, as we are going to discuss about liver diseases and their treatments, first tell our viewers that what is liver and its role?
See, liver is a very big major organ in our body. Takes around 1/4 of your body weight. So
Yes.
it has a complex range of actions. People know about heart and brain commonly because it is more advertised and more aware because it is critical. But liver as such, it deals with all, it is like your backbone of your body. Backbone in the sense means whatever you eat, what
Yes.
it gets converted, how it role plays in every sector of your body, starting from blood, your neurons, your hormones, your metabolism, your excretions, everything liver has a play. But it is a very silent organ. That's why since the diseases are not common, like diseases are not so morbid in the sense it is not acute, so that's why people are less aware.
Yes.
What I mean to say is that whenever a liver disease happens, it takes months and years to come into your the screening modalities or ultrasound. So that's why people usually ignore. Okay, my liver is okay, and it is a very silent disease in the sense you cannot detect it in the early stage with test or scan. And when liver damage happens, then you cannot reverse back. So that's why it is a very chronic disease. Like one people has diabetes or blood pressure, they take medicines, they can monitor. But somebody has liver disease, and the very few people know what is a liver disease and what is the spectrum. Majority of the liver disease, what we tell as fatty liver, actually it is a health related, lifestyle or your diet related things. So these are people ignore it because it is a very common thing. Oh, okay, we will see like that. But when it slowly progresses over years and months, then people cannot reverse that. Then they go to doctor, specialists, they run pillar to pillar. So liver, from technical point of view, in generally I will say liver helps in your hormonals, it helps in your digestion, it helps in your metabolism, it helps in your muscle growth, it helps in your disease modification, it helps whatever you take, whether you take medicines, whether you take water, whether you take any kind of diet, whatever, liver comes into play. Liver is the filter organ. It chooses whatever good for the body, what is not good for the body, it excretes and separates. Then it goes down to the kidney. Kidney is the end organ, but liver decides what is good for body, what is not good for body. Liver is the source where your cholesterol starts. Liver is the source where your bleeding issue starts. Liver is the source wherever your hormones issue starts. Liver is also the source where thyroid related problem starts. So everybody thinks the disease but they don't know what is going on in the backdrop, because it is a very medical related. People are not aware of these things. So in that way, liver it's like a mother to the child, I will say. It is a very
Okay.
silent. It will tolerate a lot of your kicks in the body, whatever harm you do. But once it gets damaged, there is no turning back. There are no medicines as such for liver medications like you can take and
Okay.
you get cured.
Okay.
You just can modify it in that.
Yes, sir. Sir, it's great to know all these information, and it's this very useful. And as you told that liver is the very like most important part in our body, so it's important to take care of liver. Okay, thank you, sir. So, sir, as you told, like fatty liver, you know. So, can you explain what is fatty liver and what are the symptoms so
Okay.
that people can get to know कि they have fatty liver?
Okay. Fatty liver is like the term signifies fatty liver, fat deposition in the liver. So somebody will ask, is it normal or it is abnormal?
Yeah.
You have your body composition. You have muscles, bones, and fat. Somebody in the body outer composition, you have less fat. Somebody is more fat. So we
Yeah.
classify fat, obese, super obese in that category medically. In same proportion, fat gets deposited in the liver. So what I told earlier, liver, whenever you take a diet, carbohydrate, protein, fat, they get segregated in the intestine and they go to the liver. Liver distributes them in different ways chemically, and when I will only discuss about the fat part, whenever there is excess of fat, like calories in terms, and those fat don't get utilized by the body organs, that liver decides. When there is excess, so those fats get stored in the liver. Once those are stored in the different cells, slowly they grow. You are taking diet, you are on excess diet, you are not utilizing, you are not doing exercise, you are not utilizing the same way your input, your output is not there. Where it will go? So it gets slowly deposited in the liver. Over months and years, those are detected in the ultrasound as fatty liver. Grade 1, grade 2, 90, you will find 95% of the populations you do ultrasound in general. If they are adults group, like body weight 60 kilos or 65, 70 kilos, invariably everybody has fatty liver. This was not there 10 years back because of the lifestyle. Everybody is eating good, but not in the way they are doing work, physical work. So where that will go? That is stored in the liver. So with time, so it is not a disease. You get to know that fat is deposited. Like fat is deposited in your body, you get to know it is bad or it is good, but it is bad for long term. In the same way, how the fat is bad for heart and other organs, you have this problem.
Yes.
Same way, the slowly, it is like oil. Fat is like the oil in the liver. Once over the period of months and years, those fatty livers, this oil causes burning of the liver tissue. What we called as NASH, N-A-S-H, that is called as hepatitis, means inflammation of the liver. So initial stage is fatty liver, nothing, you don't have disease, it is just a condition. But you should get to aware that if this continues over the years, then it will lead to damage of the liver. Then once your hepatitis starts, means damage of the liver, there will be indigestion, bloating. In general, problem will start. You will not get to know. You will think it is acidity. You will think it is related to food.
Yeah.
Then after 5 years, when that damage persists, then liver cirrhosis or damage happens. And we are seeing nowadays it is common because of the westernization of the food, because of the change of the lifestyle, because of the urbanization, because of everything.
Okay.
That's why it is common nowadays. These things are coming.
So these are the reasons for fatty liver, like mainly our lifestyle and eating habits. There is any other major cause for fatty liver?
Fatty liver, I will say it is like 80% and 90% are people oriented. Their diet, their lifestyle. 10% are genetic. 10% genetic in the sense means like whatever small they eat, they will gain weight. It is like genetic predisposition that they gain weight very early. Those are very few people. just keep
Yeah.
aside those things. 90% of the patients, whatever people they have fatty liver, is because of excess diet. Whenever somebody gastric patient comes, if you ultrasound shows fatty liver, it will give a roadmap, clear map about the patient having. I don't need to inquire. If I just ask them about how many non-veg, how many fried items, how many times you take outside food, it will just invariably it will be clear that they will be taking overeating. So
Okay.
people don't know actually. It is not their fault that they are eating more. What is the quality of food is important. Even if you are a vegetarian, you are on a different diets, you can have fatty liver. It is not that only non-veg or fried items causes that.
Okay.
The fundamental thing you have to understand, people think fatty liver. Oh, if I take excess fat, I will have fatty liver. No. If you take excess of carbs like sugars, forget about sugars. If you take excess of rice, cereals, chapati, dosa, idli, whatever, all those are
Okay, that we
starch,
call healthy
carbohydrates.
food.
If you take of excess in the liver,
Okay.
that gets stored as fat. Carbohydrates get converted to fat. It is actually the innate mechanism of the liver is to store those things for emergency.
Yes.
It is for emergency, like if you don't eat food, those are utilized. That's why if you do
Yes.
fasting, you lose weight, na. But
Yeah.
you are not affected. Those fat gets burnt out by the liver. The liver, in the sense, it is like balance. If you load it, it gets overloaded. Then it's called fatty liver.
Okay. Okay,
So
sir.
even if vegetarian people, those are like Jain people, they also have fatty liver because they only eat carbohydrates. So balanced diet is very important.
Yeah, means balance is important, like
Yeah.
how much you are eating and how much you are exercising in physical activity.
Everything is interrelated. It is not that okay, I will do dieting, I will eat not this that, I will have remove the fatty liver. The way fatty liver starts, like it takes months and years to deposit fat. In the same way, it takes months to clear away of fat.
Yes,
So
exactly.
when I counsel my patients, it takes half an hour. It is like mental willingness. It is more of a willingness of a person to
Yeah, correct.
get to those kind of things. It is like awareness. You take care of your body. What
Yes.
you eat, what you not eat, you just choose. It is simple way.
Okay, sir. So, what are the treatments if anyone has fatty liver? So, what will be the treatments?
See, first of all, we need to see that fatty liver is not a disease. So patients have abdominal complaints. They come with ultrasound. It is fatty liver. But we need to see what is his complaint. Actually, it is because of stomach acidity, or because of constipation, or because of IBS. Multiple other gastric related, abdominal related disease or symptoms are there that may mimic as fatty liver. Per se, fatty liver does not have any symptoms. It is asymptomatic because any organ inside the abdomen is painless. There is no pain, so there will not be symptom. You will have vague discomfort. It may be related to pancreas, it may be related to gallbladder, liver. Because once fat gets deposited in the liver, it also gets deposited in the pancreas. So first we see any major organic causes are not there, any kind of stones or acidity endoscopy. If we rule out organic causes, if only fatty liver is there, then we go on lifestyle changes and we see liver function test. That I told you na, that once fatty liver progresses, it may lead to NASH or steatohepatitis. In that case, is that liver function test, few parameters are important to see whether it damages the liver. If the report says that liver has not damaged, we ask the patient to modify. Invariably, those people who have fatty liver and they have problems, in my experience, we have seen they have diabetes. Some people they have some kind of lipid profile problems, some cholesterol issues, some kind of cardiac, thyroid, because these all things are interrelated. They are like a triangle. Diabetes, cholesterol, fatty liver are like interrelated because everything is related to diet, lifestyle.
Yes, exactly.
So once you take that one, it is not that it is targeting one organ. Whole body wholesome you have to see. As a doctor, that's why we advise the patient as a wholesome, whatever things are not. It is not that one organ is affected, another is not affected. So if the LFTs are normal and only ultrasound says fatty liver, So we advise lifestyle changes, diet, what kind of diet to be
Okay.
taken, how to sleep, when to sleep, everything. Water, sleep, diet, work, everything related. Once you have stress, you will go on binge diet. That is also related.
Okay.
Okay. So once you are dehydrated, you go on salt diet more. So if you take more salt diet, you take more fried diet. It is more calories. So
Okay.
it takes enormous amount of time to counsel the patients. It is not short term that we tell them lifestyle changes. Every doctor says that lifestyle change. What is that lifestyle change? One
Yes.
person should know what is lifestyle change. It is not going to
Oh,
happen within a single day or 1 week. It takes weeks and months of habit. It takes time.
correct.
So if
Correct.
the liver function tests are damaged, then we suggest some medications like cholesterol lowering medications, other medications. And some liver medications are there that may be protective. But always, 95 or 99%, I will say, if tell the patient, if they don't change the particular diet or whatever they are taking that is causing liver, it will not get reversed. I have seen their patient will come to know.
Okay.
They will come to know. Medicines will not work. So that is the second stage. If the LFTs are direct, then we give medications. Very few
Okay.
medications are there. This is the.
Okay. Okay. Thank you, sir. Like you told many things how to prevent and how to treat fatty liver, and I want please repeat like the what are the main prevention? Like you told us lifestyle changing and modification and few other things. So please just elaborate one more time.
See, I will give you the best example myself.
Yeah. Yeah.
Actually, I
Yeah.
had
That's great to
that
know. Yeah.
fatty liver. I had
Okay.
genetic hypercholesterol in my family.
Oh. Okay.
So in the early times, I know in the future, if I don't check my diet or I don't control on my diet in the reports, then in the near future it will happen. Why
Yeah.
near future means, suppose you are in the 20 to 30s, you have
Okay.
a certain body metabolism. You see kids and youngsters, they can eat whatever they can. They will be
Yeah.
fine because
Yes.
your body metabolism is like that. Once you enter into the 30s to 40s, that phase, then the body metabolism slowly decreases. It is a natural. It
Yeah.
is not that you are having disease. It is natural process of human things. Then
Yes.
once
Okay.
you enter into the 40s, it slows down. So that's why most of the people get to know about the disease in the 40s, because they will have starting problem, because body is not sustaining. If they take some major amount of food, they will have discomfort. Then they go doctor, they will have detection sugar, they will find the cholesterol. So in that way, if somebody has cholesterol or diabetes, they see LFTs. One should check for ultrasound and liver function test. It should be done. Now there's European and American, we have Indian guidelines also, that
Yeah.
those who have metabolic syndrome, those who have diabetes and cholesterol, they should also check for liver test, because it is also related. Cardiac diabetes and your health being, gastric things are interrelated. So in that things, if the liver function tests are normal, you go for lipid lowering drugs like cholesterol, whatever problems you have, consult the doctor.
Okay.
And if those things are normal, if you have only
Okay.
fatty liver, so the things is that you have to check whether you have cholesterol or not. That will give a certain parameter. They will be having some kind of borderline hyperlipidemia, like 200s to 250s, not too high. If somebody has too high, I usually tell them go on restricted. First,
Okay.
I advise them to cut down on non-veg, because it is the major source of fat, big fat.
Okay. Yes.
The point is that only non-veg is not important. You are cooking the non-veg in oil, so it takes it. The cooking of the non-veg always carries a greater amount of oil, so it demands oil more. So more
Yes.
fat is taken. So in that way, first you should cut down on the non-veg diet. The red meat is important. It should cut down. Then comes chicken. Then comes fish. Then comes the egg. These are all in the decreasing order of damaging to the body.
Yes.
Now this part is the non-veg part. You should cut down so that your whole calories and the oil intake is decreased. So we
Yes.
advise for cutting down on fats and oil. Second point is that you should cut down on outside fried processed foods like burger, pizza, cheese, pastries. or like those what about any kind of fried items?
Junk food, yeah, I can say.
One point is that nowadays research are there are European, Korean guidelines are there. They have banned because those French fries are GMO modified potatoes. GMO modified means genetically modified. Those potatoes are in such not good for health. That means what I want to say is that GMO fat that French fry, processed oil is okay. You take one snack, but that potato will not get digested in your body properly because your body is not used to it. It is artificial. You the people take, they don't know because they cannot be aware of it. But long term intake, it will cause fatty liver, it will cause more damage. So those things had to be cut down. Now coming to fat things, now coming to second part is you have to cut down on carbohydrates. These people they miss, even diabetes people, they don't miss. They think if I don't eat sugar or sweets, my diabetes will be controlled. No, if you take too much of rice as per your body weight, too much of chapatis or whatever, too much, any kind of carbohydrate, even idli, upma, whatever, that will get stored in the liver as fat, contribute to the body fat, whatever. In general way. So from the outside, how you will know whether fatty liver has improved or not? You will have weight loss. If you think you have become thin or you have done a weight loss, fat loss, then automatically inside also there will be loss of fat in the liver also. In the same way, there will be loss of fat in your coronary arteries also. Okay, so if somebody has cardiac or metabolic syndrome, diabetes, some drugs that they are taking for cholesterol, the fat will be digested in the body in the same way from all organs, in the same way from your outside, in the same way from the inside. It is just a different mechanism, but in gross way it will be digested or you will lose fat. Now the third part is, this is about diet. Third part is about physical exercise. Only diet will not. If you don't take diet, your muscle become flaccid. If you don't go for exercise or whatever, it is like simple walking or running, cycling, physical. You should sweat out. Whether you do treadmill, whether you walk, whether you run, you just move around. Otherwise, this is scientifically proven. If you move around a little bit, your body hormones get upgraded. Suppose somebody is taking diabetes medications, the medications will work better in the body mechanism, that insulin resistance that will work if the person gets into exercise. It has been proven. Only diet will not. Otherwise, they will be on medications. These things will work when the person per se decides, okay, I will take care of my body. This advice will not work unless and until they understand, okay, this is not about threatening. This is about taking care of your own body to live happily and comfortably. You will not go to a doctor. 90% of the problems will get resolved if you do some exercise and take care of that. Now you can eat your food, something you want to enjoy, you want some kind of fast food. It's sometimes infrequently, not on a regular basis. But in your home, you check that I will cut down on food, I will go on fasting sometime. If you go on fasting for 8 hours, 10 hours, your liver and other organs get time to metabolize. If you go on dropping food, then what happens? The resistance happens. That is called as insulin resistance. That leads to diabetes after 40s from the early age. That's why younger generation, they should know that time, not the older generation. They should modify this lifestyle.
Okay. It's great to know that how we can prevent, and you told us very important things, and it's really very helpful. And one more thing, sir, a few our viewers have asked, like, what are liver cysts and can it be serious?
Liver cysts are most frequently in the ultrasound they are diagnosed. 90% of the cysts are simple cysts. Basically, those are simple cysts like fluid-filled cavity. Those are asymptomatic, don't cause any pain. People used to come and say, after seeing the report of the right side liver cyst, they will say, we are having pain in the right side. But if you inquire, they will have pain in the muscle and bone, not inside liver. As I was told, liver is painless organ. Any organ inside the body is
Yes.
painless, unless and until it stretches the capsule. Means it is stretching cause a big tumor or cancer. In the advanced stage, they cause pain. But in the early stage, tumor or cancer, they are asymptomatic. They don't cause any pain. And liver cysts are simple cysts. They don't require any treatment, nothing. Only in 10% of cases, those are polycysts, like those are genetic. Those size more than 5 to 10 centimeter. You need to consult a liver specialist to evaluate. I'm not going to details. Those are 5-10% of major problems are there. They can convert into tumor. They can cause problems. They need evaluation. But 90% of the general persons who have simple cyst, ultrasound will say they don't need any treatment, nothing to worry.
Okay. So can it be cured, liver cyst?
Yeah, you don't need any treatment. It will not cause any problem in the future in your lifetime. So you don't need any cure, basically. You don't need any treatment first. That's why I told you. Those are simple cysts, 90%. 10% cysts are large, like 10 centimeter, more than 5 centimeter. In the ultrasound, you just consult your doctor whether it needs any evaluation or not. If you are worried, you consult your doctor. They will assess betterly about the liver cyst. But 90% of the simple cysts, they don't have any problem.
So, sir, is there any prevention tips to prevent these liver cysts?
No, liver cysts are not actually, they are like genetic, or I will say idiopathic. They don't have any cause. They come up like you have boil in your skin like some kind of genetic, like scar kind of thing. I'm not telling pustule or redness. Those are by birth. So kidney and liver, simple cysts, they are present, like detected in the ultrasound only. So they are not causing any problem. Neither they are formed or they do need any prevention. So you should not be worried about those things.
Okay. Thank you, sir. Thank you for telling us all these important information about liver diseases, their symptoms, causes, treatments. So thank you so much for your time.